And it's Michelle, is it?
It is Michelle Tolley.
Please state your full name
Michelle Tolley.
and repeat after me. I do solemnly, sincerely
I do solemnly and sincerely
and truly declare and affirm that the evidence I shall give
that the evidence I shall give
shall be the truth,
shall be the truth,
the whole truth,
the whole truth,
and nothing but the truth.
and nothing but the truth. Thank you.
Michelle, you were infected with hepatitis C following blood transfusions in the 1980s.
Yes, that's right, 1987.
And you're aware you received blood transfusions on at least 2 occasions relating to the birth of your children. What hospital was that at?
So that was Barking Maternity Hospital in Barking in Essex.
And your first child you gave birth to in 1987, you had preeclampsia and you had certain difficulties in relation to the birth which resulted in you being given a blood transfusion. Can you recall any of the details?
Yes, I hemorrhaged quite a lot. And I just thought everybody felt like that after they'd had a baby. I couldn't stand up properly. Everything was just like this, my nails, my lip. It was, I just didn't feel right. And one of the nurses said to me, we've done your, we've checked your bloods and you actually need to have 4 units transfused.
And you've not been able to get hold of any maternity records from that time. They've been destroyed.
They've been destroyed, yes.
But your recollection is that you received blood over quite a long period of time on that occasion.
Yes, it was about 18 and a half hours.
Can you recall how that transfusion made you feel?
Well, actually, it actually made me feel quite good because I was then suddenly, I had a bit of energy back in my body and I've never had a baby before, so you just go on and get along with it and sort of jolly on.
You gave birth to your second child in 1989.
Yes.
And again, you had some complications in relation to that pregnancy.
Yes,
gestational diabetes.
Yes, that's right.
You lost some blood on that occasion and you were given iron tablets, but you didn't require a transfusion.
Not at that time, no.
But you did get given a document after that, I
Yes.
think. Could we have up on screen, please, Paul 276002? If you look at the screen in front of you, Michelle.
Yes, that was actually sent to me through the post when I was having a rather late blood test with the second child, Lauren. I must have been about 32 weeks because it was at the same time that I found out I had gestational diabetes. So both the letters come through at the same time. And I looked at that, and at that time, it was all kind of in the news, sadly, about AIDS and HIV. And with panicking, I rang my mother-in-law up at work and I was like, oh my God, I've got something's wrong with my blood, and panicked. And I've managed to keep this card all the time. If ever I have to have another blood transfusion, they have to carefully cross-match.
Okay. And it refers to your blood containing atypical antibodies. Did anyone ever explain to you what was meant by that?
No, nothing. I did ask one of the midwives and she said, oh, that's perfectly normal. You've had a blood transfusion.
Now, you then had your third pregnancy with twins.
Yes.
And you've described in your statement that you remember that being awful throughout.
It was a terrible, awful pregnancy.
And you had to have an emergency caesarean section.
Yes, I did.
And did that result, again, in you having to have a blood transfusion?
Well, it's a little bit awkward with that one because it was an emergency. I wasn't awake because the twins had actually stopped breathing at that point. And on my note from the doctor, the patient summary care report that they keep, it says 2 units given at birth. But I didn't, I had a caesarean, so I don't know. But I had 2 units further on because they kept me in for 10 days. They wouldn't discharge me.
So after the twins were born, you recall having a blood transfusion of
Yes.
2 units. It may be that you also had one during the the surgery itself.
Yes.
And can you recall anything about the physical surroundings in which this admission to hospital took place?
Yeah, it was really strange actually because so in Barking Maternity they've got two. It's not there now, but it was two very long wards, one on top of the other, and I was rushed upstairs, which was totally closed down. The operating theatre has not been used, and the twins were born there.
And this was early 1991.
February, yep.
Now you went home with the twins, and then you moved in 1992 to Clacton.
Yes.
And you registered with a new doctor.
Yes, I did.
And sometime around this time, in the early mid-1990s, you saw something on TV. What was it?
I can't quite actually remember what it actually was, but I knew it was something about the screening of blood and some information. There was a telephone number which I telephoned. They sent me a magazine come through, and it was advised to go to your GP, which I did.
And was it something about blood transfusions and infection?
Yes, it was, from what I can remember, and that's how I'd heard about hepatitis C, it was if you'd have had tattoos, dentistry, operations abroad, blood transfusions, etc.
And were you already experiencing, by that time, any symptoms?
Well, I was really, really tired, but then I had 4 children in 3.5 years, so...
So you called the helpline, and they suggested, amongst other things, that you make an appointment to see your GP.
Yes.
And that's what you did?
That's what I did, yes.
So you went to see your GP, and you asked for a blood test, because you were concerned, having heard about this, that you might have been exposed to hepatitis C. What happened?
So I went in to see him, explained that I was... exhausted, absolutely exhausted, and that I'd had 2 separate blood transfusions before the blood was screened. And he said to me, well, you will be tired. You've got 4 young children. I don't know what you expect. And as to the blood tests, don't be silly. You won't have that. And that was it. Get out of my office. It made me feel like a silly little girl. And as a young mum, you look at your professionals, you trust them. I believed him, and off I went.
So then, 1993, 1995, you were experiencing heavy bleeding associated with menstruation. You were experiencing abdominal pain, and you were referred to Colchester County Hospital for investigation.
Yes, that's right.
And you had a procedure there. Do you remember anything about, again, the physical circumstances of your admission?
Yes, so they have a day unit. There was a day unit there. But they took me upstairs onto a closed-down ward. There was all beds not made up except for one. And my mum actually was with me at the time, and she said, well, why is she here? What? This isn't right. And there was, oh, no, they've miscalculated, but we didn't want you to miss out having the procedure. And that was the only explanation we got.
Now, there came a point in time at which the fatigue that you were experiencing was such that you were suspected of having glandular fever.
Yes, that's right.
And you were coughing, you had throat problems, and you relate in your statement a summer holiday period in terms of the children's school holidays when you were very ill and couldn't do anything.
Yeah, I literally was flat out for 6 weeks. It's awful for them, really, because I couldn't go out and do the activities that we like to do. I was just shattered. In fact, I think, because I was working in a school at that time, I didn't even go back to school to work for a couple of weeks because the fatigue, it was just ridiculous.
But because of what you'd been told by the GP when you went to see him, you put it down to your personal circumstances, lots of young children, it just being an exhausting process. We then come forward to 2004, and you were diagnosed with type 2 diabetes.
Yes.
So by this time, can you give us a flavour of the kind of physical symptoms that you were experiencing?
So still the chronic fatigue, which was getting worse. Still lots of sort of gastric-y problems. I had bleeding gums. Bleeding gums. and just that general, I was doing lots of different activities at the school with the children, run several groups, and I think it must have just been, sorry, I'm just getting it in my mind. So I was suffering with severe thrush at the time, and a teacher said to me, you must go to get that sorted out. I've never experienced it before. So they did a urine test, and they was like, oh, okay, there's some sugar there. So then they did a needle prick test, and the nurse was like, oh, your sugar level's on 24. And then they called a doctor in to speak to me. But to be fair, I just finished umpiring a cricket match. And, you know, he's talking away to me and I'm looking at him. But to be fair, he was just like he was going, nothing was going in. So I was just kind of just, you know, and then it was all this kind of, let's try it with diet. That didn't work. The sugars kept progressing. I was put on medication. And it was... At one point, my liver enzymes were really high, and then I'd got a different GP, same surgery, but a different. But she was absolutely lovely, actually, and she said to me, but she said it was missed because she said of the diabetes, that's why the liver's a bit like that, and it just never was really looked at. To me, that was then a second missed opportunity.
So what you've described in your statement is in around 2004, whilst being tested for diabetes, your liver function tests were undertaken which showed that your liver enzymes were elevated above normal levels.
Yes.
And then you had further liver function tests, you think about 2009, 2010.
Yes.
Again, they showed raised liver enzyme levels, but no further investigation or inquiries were undertaken.
No, nothing.
And that's why you've characterised these as possible missed opportunities.
Oh, yeah, I do. I think there's been several missed opportunities along the way.
So it was autumn of 2015 when you finally received a diagnosis. You'd switched to a different GP and you attended for your annual diabetic blood test in October 2015. What symptoms had you been experiencing?
So by that stage, I was really, really ill. I'd lost lots and lots of weight for no reason. I wasn't trying to lose weight. It was just falling off of me. In actual fact, I think in my uniform for work, I'd gone down about 4 or 5 different sizes just suddenly. Gastric, sick, lack of appetite, fatigue at this time was ridiculous. I used to work on the customer service desk. At my break time, I'd take my insulin because now it had risen to insulin and more medication, and I'd try and grab a quick power nap before I was then back seeing to customers, etc. But I couldn't cope with it. I was ill. I was so ill, and I said to my husband, Dean, I think there's something really seriously wrong with me. I think I'm going to die.
And so the surgery took the blood test, and then your GP called you back in. And what did the GP tell you?
So he said to me that my, I think it was a GGT levels.
Glucose tolerance test.
Oh, yeah, no, the GG. So the one that's to do with your liver, yes. He said that had come back over 3 times higher than what it should be. But they'd also called me back for a couple of... I'd had one blood test done, and then they called me back in and they said, we didn't get it sent out all the time. We need to check it again. And so I went to see my GP, lovely man, and we sat down trying to find out why, and you get the questions, have you injected drugs? He said, I have to ask you this, are you an excessive drinker, which I'm not, and he just said to me, I can't understand it with all your symptoms, and it was literally like a light bulb went ding, and I said to him, hang on a minute, I had 2 blood transfusions before the bloods were screened back in 87 and 91. And I went to my GP in Clacton-on-Sea, and he told me to go away. And he was like, oh. So I went through the story about, getting the literature through, understanding, being turned away. So he tested me that day, and it was about 2 or 3 days later, he actually phoned me at home and told me I was positive for hepatitis C.
And you described, just going back to that consultation you had with him when you had this light bulb moment and you told him about the blood transfusions. Yeah. You've described in his statement he actually put his head in his hands.
Yeah, he did. He did this. He was like...
and then he phoned you, as you said, not long afterwards, to tell you that he was very sorry, but he had to tell you you had hepatitis C.
Yes.
What was your reaction?
I just want to add there, he did ask me to come and see him straight away, but I wasn't quite ready. I needed to digest that information. I was terrible. I literally almost collapsed to the floor. My husband at that point had been working nights. My family had all left home. And I was just hysterical. I was like a hysterical little child, because every time I shut my eyes, there was a coffin. All I could see was a coffin, because I didn't understand hepatitis C. No idea of it. I know, anything hepatitis could be related to maybe, prostitution. People don't understand the disease. So then my husband's come in, finding me in a complete mess, and he was in, we were both in a complete mess. I then withdrew. I didn't want to speak to anybody, and I like talking, as most people know. But I really withdrew, so I wouldn't even speak to my children. I didn't want any interaction with my husband. I wouldn't go out. I did finally go along to my GP, which actually was really good, because when I phoned and said I need to see him, and I give my name, they said come straight now. So that was very good.
And he was honest with you, I think, but
he was,
didn't
yes.
know very much about
No,
hepatitis
he did.
C.
He said to me, I don't know nothing about hepatitis C. He said, however, and he'd printed several sheets off for me, and gave them to me for reference, said to me, whatever you do, please don't go on Google, as we do. And I did have an appointment rather quickly, but just going back to my feelings of that withdrawal, that was, I've never experienced that before. That was absolutely awful. And then I felt dirty. So I can remember sitting in the bath and scrubbing, actually drew blood, where it was just, but that's how I'd made. And then I got really angry, and I mean furiously angry. And I had to have the blood after the transfusion. I had to have it. I'd hemorrhaged further and died. But it was a GP, that had that opportunity to give me a simple test that could have saved
all those years of not knowing.
Yeah.
And of feeling ill and not knowing why.
I felt
and not having treatment.
Absolutely, I felt let down. I felt betrayed, and it's left me with a huge mistrust of medical hospitals now.
Just going back to the original transfusions, obviously the second one, you've described the emergencies that arose and the circumstances in which you were given it. But did any of the medical professionals on either of those occasions ever give you any advice or information, even if it's after the transfusion, about risks of infection?
No, not that I can remember.
So your anger's not the being given the transfusion. Your anger is in relation to the infection, but in particular, in your personal case, in relation to the missed opportunities.
Yeah, definitely. I mean, don't get me wrong. I'm still angry that there was hepatitis C in the blood, and I'm, really furious about that. But it would only have been 7 or 8 years if he had given me that test. I wouldn't have ended up with the amount of health issues I've got now. That stole my life.
Now, the GP who finally assisted you in finding out the diagnosis, I think he referred you speedily to your local hospital, and you were seen there quite quickly, and
yes.
You got the results back in relation to confirmation that it was genotype 1A.
Yes.
What then happened in terms of you receiving treatment for the hepatitis C?
Yeah, so it's a bit complicated, that one, because I saw one doctor first, because they suspected that I actually had pancreatic cancer and then lymphoma, first of all. They forgot to do my fibro scan. And then there was a 6-month wait to see the hepatologist, and there is no way on this earth I was going to wait 6 months after I'd just had that down in news, and remembering that the doctor had sent me away. So I kind of very kindly persuaded the secretary at the time to pull me forward slightly by 3 months. And when I got to see him, my fibro scan result when they did it then come out, I think it was about 39.7.
So that scan confirmed you had cirrhosis?
Yes. So then it came down to treatment. So with the NICE guidelines, if you've got cirrhosis, you kind of go more higher to get treatment first. And I'm not going to go into an awful lot of detail, but I had a phone call saying you can have treatment and you're going to have the AbbVie triple regime. And I was like, brilliant, great. She said, you just have your colonoscopy just to make sure nothing serious is showing from that, and then we'll be ready to go. Fantastic, brilliant. And then, I don't know, see brain fog, it was so... I then got a phone call saying, actually, we're sorry, your funding's been withdrawn. Where we used to treat 8 a month, it's now gone down to 2. It's out of the trusts, it's come down above the trusts. And I was just gobsmacked. They might just as well have told me I'd Hep C again. That's how I felt.
Were you were told you weren't going to get the treatment then for the reasons you've just explained?
Yeah.
Were you told whether you'd be getting it at all, and if so, when?
I asked. I said, well, how much longer am I going to have to wait then? And she said, month, 6 months, year.
So what did you do?
Well, I thought, I'm not having none of that. I'm sorry, you gave me this mess, you can get it cleared up. So I spoke to somebody very nice from the media who said, would I mind if they intervened and had a chat? And I was absolutely no. And I think it was about a week later, I got another phone call to say, we've got some funding for you now, so you can have your treatment.
And that was through the medium of a local radio station?
Yes, it was, yes.
So you began the treatment, the AbbVie triple therapy regime, in September 2016.
Yes.
And that was a 6-month course?
6 months, yes.
So that took you through to March 2017?
Yes.
And what was the outcome in terms of the virus?
So it took a little bit of a while for the virus to go. That's why I think I had the extended 3 months, also because of having the cirrhosis. I did have ribavirin, 6 tablets a day for 6 months, which I thought was actually going to kill me. I believe it's because of that drug that my hair hasn't grown back, and I'm 2 years SVR now, which means undetected. I'm sorry, what was your question again?
That's all right. The outcome of the treatment after 6 months was that the hepatitis C virus was now undetectable.
Undetected, yes.
But you were talking about the side effects.
I had terrible. I felt worse. I feel worse now, and especially when I was on treatment than when actually I had the virus live. The pains. I can't explain to you the pains. People who've suffered will know what I mean. It's like pain in your bones, the aches, the fatigue. I would be sleeping for 16 or 17 hours a day. I just could not get out of bed. I've never experienced anything. And I kept saying to my hepatologist, I've got continued pains. And I was then under a bowel specialist. I'd been under a cough specialist, the respiratory, for this chronic cough that I had. And finally, sorry, I'm going to have to step back a bit. I think it was February 2016, I think it was that, it might be 17, but it was 16. So the pains were so bad, and I was coughing up a little bit of blood, that I phoned 111, and eventually an ambulance came. They said, no, because my blood pressure was really elevated, my sugar level had gone up, I was taken into hospital. And it was found there that I'd got acid reflux and I'd got a disease of my esophagus, but I needed to have my gallbladder removed because there was lots and lots of stones, and that's what the pain was. I said to the lady nurse who was dosing me with morphine because the pain was that bad, that I had hepatitis C. The one thing I needed to let them know that. Looking on my records now, bits of records that I've been able to get, it's actually got a print. I've got a printed. That when I was admitted in, it said I was HIV positive. So, and I'd asked to be tested for HIV, and the letter come back saying I was negative. So to have had that letter saying negative, and then to look at a hospital record, which was typed, it wasn't even handwritten, to say I was HIV positive was just, whoa. So that then was investigated by my GP, and she was satisfied that the bloods were fine, and that was just an error on the hospital's point. But that's a big error.
You've had, in terms of other physical medical complications, you've referred to the removal of your problems with your gallbladder, and you eventually had your gallbladder removed.
Yes, I did.
You've had bleeding in your eyes. Do you know? Have you ever been told whether there are any connections between the hepatitis C or the treatment for hepatitis C and any of these other matters?
No.
You don't know?
No, nobody's ever said I don't know, and nobody's ever said. My eyesight's predominantly got worse. I'm still under the hospital. I had to have injections in my eyeball. And yeah, this one's starting to go now. So I don't know if there's a connection there. But I had Hep C for 29 years.
And you've said in your statement that one of the difficulties associated with having all these other medical complications, whether or not they're related to the hepatitis C, is you have this distrust now of the medical profession.
Absolutely.
And yet you are constantly having to put yourself in the hands of the medical profession.
When I had my gallbladder out, I had to sign a document that said that I could possibly bleed to death on the operating table because of the cirrhosis. I needed to stay in hospital overnight, where usually it's just a day case. And it was just there in the back of my mind, and it's a really, really silly thought. But I just thought, it would just be so easy to quieten me down, just to give me a little bit more anaesthetic. And that's actually what was going through my mind. Just, they could get rid of one more. It would be simple, because I'm overweight. You have a risk when you have an operation anyway. So when I actually woke up afterwards, I was rather shocked. I was still here.
You've said in your statement that the infection, and I think also the fact that it was undiagnosed for so long, has had profound effects on your mental well-being.
Oh, absolutely. Oh, yeah. I mean, to be fair, I've been an absolute monster at times. Literally. I mean, how my husband puts up with me, I don't know. Because sometimes and I'm sure others can relate to this, sometimes you wake up and I feel like I'm in a black cloud, and there's nothing that can bring me out of that. I just have to be alone, and my husband's learned now it's hard for him watching me suffer that way, and then just crying for no reason. And then the most simplest of things, you're flaring your temper, you're angry. So I don't think I've ever got over that initial diagnosis. And then I get angry thinking about the doctor that sent me away. And I just think all them emotions, it just gets a bit too much sometimes. So then when we go back to talking about brain fog, I could be saying, I might be wanting to say hello to you, and this is Kaz. But then I'll look at Kaz and I can't think of her name. I know it's there, and then you get frustrated because you can't remember. So then with my husband, I'll be, and it's really frustrating. I mean, don't get me wrong, it's got easier, but I still have moments when that cloud is there and it just goes. It's the most awful thing I've ever experienced.
And you've had, and you still have, I think, terrible anxiety.
I do. Yeah, there are times when we're at home, and my husband will go, "We've been in for a week. doing home shopping, we need to get out. We need to go out. And I'm like, no, we don't. No, I'm too busy. No, I don't. It's because I don't want to see people. I don't want to. Sometimes, I think I still sometimes get that little bit where I need to go back into myself to think and reflect, and because it's only still been 3.5 years for me, and I'm like a sponge trying to absorb all this knowledge and understanding. And it's not just what happened to me with transfusions. Then there was a haemophiliacs that I'd kind of heard of but didn't understand, and then suddenly there's a whole new lot of people. And then you start thinking, my goodness, this is terrible. How's this been allowed to happen for 40 years?
You've, as well as the anxiety, you've been experiencing depression.
Yeah.
You're not currently taking antidepressants.
No.
But you've had dark days.
Yes.
Particularly after the initial diagnosis.
Yeah.
And I think to the extent that you had, on occasions, suicidal thoughts.
Yes, very, yeah. At the beginning, there was no reason for me to get out of bed because I was useless. I'd lost my job. I'd lost 30 years. What good was I anymore? And that is really difficult to deal with, to feel that you're worthless and that you don't mean nothing to anyone anymore. And I don't mean my family, but in terms of your job. Yeah, my work was very good with me, really, really good, I have to say. And I was quite happily there, you know. I did the farm to fork with the children. I did some in-house magazine work, reporting, etc. And that's gone. That will never come back because I'm just so flipping tired all the time. I couldn't commit from one day to the next.
Although the virus is clear, do you need a break, Michelle?
No, I'm fine, thank you.
Although the virus is clear, you still have to go for scans.
Yes.
Every 6 months.
Every 6 months,
to see
yes.
whether there is further damage to your liver.
Yes.
How do those appointments make you feel?
Oh, I hate it. I'm a bag of nerves 2 or 3 days before. I'm churning up inside, thinking, my goodness, are they going to find something now? We've heard about Sally Vickers, what happened to our dear Sally. And that's always at the back of your mind, is there? And at our hospital, where I'm under, you have your scan, you might wait 3 or 4 weeks for a letter, and then you see your hepatologist, if you're lucky, and then you get sent off for bloods. So there's not like at King's, where you have your scan in the morning, your bloods, and then you see the person in the afternoon. That's all done and dusted. So this can be over a space of a month from having a scan to seeing your hepatologist, then having to have blood, and then before you know it, you're having another one. And it's just like, and it's always there at the back of your mind, because you're trying to press the sonographer or radiographer, whatever they're called, to say, well, can you see anything? Oh, well, we'll send it to our specialist, and then it'll be sent off to you. And then you think every time the phone rings, you're like, oh, is that the hospital? If they see. So yeah, it's horrible, and you have that twice a year, and you're going to have that until I pop my clogs.
What's the impact been on your family life and on your family?
Well, my family have all grown up and moved away, and I think it's been pretty hard on them, because I think it took me a long time to realise that they were affected victims. It took me a long time to understand that actually it's probably been a lot worse for them, although I've had the physical pain. I did, and it was all me, I'm not well, I'm tired, me sort of thing. But when I sort of stopped and looked, and I think just being and meeting all the lovely people and listening to the different people that are affected, and it suddenly hit me, oh my goodness, my husband and family are affected victims. It just didn't, it just didn't click. And I think it's been hard. It's been very hard for them.
They had to be tested, I think.
Yeah, my husband, they had to be tested, and thankfully they all come back clear. So that was a blessing in disguise.
And your daughters were worried because they might have used a razor or toothbrush?
Yeah, definitely. So my youngest daughter, when she was like, "Oh, Mum, we used to use your razor and you never knew," and then you're thinking, "Oh my goodness," and toothbrushes and all, you don't know what your kids are getting up to behind your back. So yeah, that was a really, really worrying time, and it wasn't only that, it's just that there's grandchildren there as well. So that was my fear, that if I'd sadly passed it on, would it have gone on maybe into grandchildren? So, but thankfully they was all clear, as is my husband.
And it's had an effect on your relationship with your husband?
Yes.
Because you've said in your statement, some days you're bright and bubbly and others you don't seem to be able to get out of bed.
No, that's right. And I just don't want to interact. I just don't want to talk, which is not like me. But when you wake up in that feeling of that blackness around you, I once described it as like a coil, and you go down and down and down and down, and you kind of get wedged down there, and you're trying to get back up, and it's really, really difficult, really difficult.
You had a particular concern about going to the dentist. Can you tell us about that?
So and I'd always, as my GP had once said to me, because I had bleeding gums, that I'd got gingivitis, and it was, can't remember if it was during the treatment or just before the treatment. I was pulling my teeth out. I could literally pull. I didn't need no pliers. I just pulled them out. I could just literally be sitting there, and I think, my husband, what are you doing? I go, I've just pulled a tooth. And I'd be like, oh my God. Literally, I think it was about 8 teeth. And no, I wouldn't go to the dentist when I knew, because I was so worried in case could pass it on to somebody else, just in case the instruments hadn't been sterilised properly.
The impact upon the family finances, you described how you've had to give up work. You ended up being medically retired,
yes.
I think, in 2016. What kind of work had you done prior to that?
Okay, so I spent about 8 or 9 years as a learning support assistant in a school. I worked with children with ADHD, that kind of thing. I spent 5 years in a solicitor's office as a PA. And then when we moved to Norfolk, because in between, I had breaks in between because I was so exhausted, it'd be like I'd had to take a year and a half out. And then I'd think, no, I want to work, And I'd do it for so long, and I'd think, I can't do it. And then the last one was when I was employed by Tesco's. Like I say, they was very good to me.
Yes, you've said in your statement that they kept you on the payroll for a number of months after you were unable to work, but it couldn't carry on indefinitely.
Yes.
Hence medical retirement in June 2016.
Yes.
And your husband's also had to stop work in order to look after you.
He did, because the state of me at that time, I couldn't be trusted with a kettle, with the simple things. I've got very bad balance issues, where it's like I'm just going to, I don't know if it's to do with the Hep C, but I get a bit dizzy. And of course there's that worry when I went through those times of thinking it'll be easier just to go to sleep and never wake up again. And he stopped work to care for me. So, of course, when I was on my medication for 6 months, he had to deal with that, because I would never have remembered to have taken them tablets. Or, on my own, I might have just thought, blow it, and took them all.
And you've had to apply to the Department of Work and Pensions for benefits. What has been your experience of that process?
Not very good, actually. Nobody likes to go with a begging bowl, pleading, having to explain when you don't even know what you are trying to explain, because you still don't really understand the full effects of it of yourself. I think it was in around about 15 months I had 3 DWP appointments. When I was called for the middle one, I actually got rather cross about that, and I phoned up and asked them what did they know about hepatitis C and contaminated blood, and the guy was a bit off with me, and I asked to speak to his line manager, and he said, oh, he's in a meeting. I said, oh, that's fine, I'll carry on chatting to you, that's not a problem. And then I kind of mentioned that I was part of a working party group with the DWP. I said, we'll use this as a two-way exercise for us both, because I can then report back to the group, the support group, if there's any problems. And I mentioned a couple of names, that policymakers that attended, and suddenly the manager was there, thankfully. And we had a conversation, and I said to him, I'm not disputing the fact that I have to come along to have an interview. I'm not disputing that. But when I speak to somebody, I want to be speaking to somebody who understands what we've been through and what we're going through. And anyway, he said, oh, I'll ring you back. Of course, he didn't. And I went along to the appointment and waited about half an hour. As soon as I walked in the doors, I was in tears. I was shaking. I felt I was going to start hyperventilating. I had to go up and say, is it going to be much longer, because I can't cope. And it's embarrassing because it's all people all around sitting there looking, and poor Dean's like, and it's humiliating. I felt humiliated. It's not my fault. I'm here. The guy then came round to me from the reception and said, oh, you won't be seeing the original person now, you'll be seeing somebody else. And thankfully, she was the most loveliest lady ever. And she understood. She was very kind. She was very patient. And, yeah, she was very nice. But it's those pre-feelings that you don't need. You're sitting there and you think, I'm going to throw up in a minute. I can't cope. I just can't cope. I suppose I got as near to a breakdown possibly as I wouldn't. I don't know what you go through, but I was in a really, really bad place, really bad. But we got through that. That was fine. Then I applied for PIP, and that was relatively okay. But at the end of the day, they've got our records from I was Skipton, now EBs. If you're on a stage 2, I can't understand, or a stage 1 payment, depending how poorly you are, why you necessarily have to keep going through these procedures, these upsetting times. If I was a vulnerable person, that could possibly tip me over the edge, where you've had enough of it. I think it's the form filling, it's the reliving everything. It needs to stop.
Have you ever been offered any form of counselling or psychological support?
There is a lady at our GP surgery that I can go and talk to, but there's a long wait. I was never offered it at the hospital when I was first diagnosed. There is a letter that says I have cancelled Misha and expressed that her children and husband should be tested. But no, apart from what's at the local, no, nothing.
And then you just mentioned the Skipton Fund. You weren't, I think, ever given any information by anybody about the Skipton Fund. You found it yourself through the internet?
Just through searching, yeah. I didn't have a clue. I wasn't told about it at the hospital. Doctors, I wouldn't expect him to know because he didn't really understand it. But no, not at the beginning.
And when you did find out about it and you did apply, what was the process of seeking financial assistance from the Skipton Fund like?
So what they need, what's their evidence? It's got to be more likely probable that you've got hepatitis C for a blood transfusion, and you have to prove it. You have to show proof. So for me, that was really difficult because my maternity records had been destroyed, as they're only kept for 25 years. I couldn't find anything else. I'd never kept anything from the pregnancies because they take all their records back. And then I had an idea to ring the GP surgery and speak to the medical secretary. And I said, have you got anything? Is there anything there? So he said, what I'll do is I'll print out, I think it's a primary summary sheet. I think it's just literally where you go into hospital That's, yeah. And when I went and collected it, it was there. It was written there that in 87 I'd had 4 units, and after the twins, the 2 units. Plus I had my little blood card as well, which I'd managed to keep.
But without those bits of documentation, you think you would have, in all likelihood, have had your application rejected?
Oh, absolutely. Yeah, definitely.
And the other concern I think you had about the Skipton Fund was that none of the payments that you received were backdated. Is that right?
No, that's right. You know, at the end of the day, whenever they started the schemes up, you know, I don't see why those monies shouldn't have been backdated to when it first started. Because, you know, being turned away several times and misdiagnosed, again, it's not our fault. So, yeah, I wasn't very happy with that, to be fair. I didn't think that was very fair.
And you've, I think in terms of support, you've derived your support on an ongoing basis from your husband and your family.
Yes.
And then also from the campaigning work that you've become involved in.
Yes. It was very, I was adamant that when I was very, very angry, that I was going to try and use that anger for something rather than be negative, to turn it into something positive. And I kind of thought, if I can just find one other person like me, because if that's happened to me, who's just an ordinary work, you know, family, wife, etc., how many more of me's could be walking out there and not knowing? You know, they may have had operations in the past, not even realise they'd had blood transfusions. So that was my most worrying thing, and I was very lucky with BBC Radio Norfolk. I'd written to one of the lovely presenter there, and he phoned me, and we had a long chat and invited me in. And to be fair, it's kind of started from there and it's escalated. Then the local newspaper got involved, and they've actually supported me and my journey through every step of the way, and they've been actually amazing, you know, really amazing.
Michelle, those were the questions I had for you, but is there anything else that you would like to add?
Yes, if you don't mind. Thank you, Jenny. Right, okay. Our community, I feel, has been divided by the government. Well, not anymore. We are united as one, and together we stand tall. We are louder, but most of all, we are stronger, and we are not going away. The haemophiliacs and whole bloods must work in unison, as we are not only representing ourselves, but sadly for those who are no longer with us. Also, plus the families of victims who have been abused by the old schemes, and the confusion that EBS, the English Infected Blood Support Scheme, continue to cause. Test, test, test. People must be tested for hepatitis C. It is a killer. How many more like me have died without knowing, where families haven't had that chance to understand? The government must test people. We are not going to get the elimination of hepatitis C if people are not tested. And just to finish off, I would actually really personally like to thank the people that have come to support me today, but also for the media for allowing us to give us a platform to help raise that awareness in trying to find other victims. To Sir Brian and the inquiry team for your trust and support, and to the Hepatitis C Trust for just being there, always. And this is where I might get a bit tearful. This is for my incredible husband, Dean. It was really been my rock during this horrific roller coaster of a journey. I couldn't do this without you, darling. I love you. Thank you.
There is just one thing which I want to ask you. You have been very angry. At what time do you think you were most angry? Perhaps as a second question, why do you think that that was when you were most angry?
It was when I was going through those first emotions, which my HR team said it's you will go through a cycle of emotions. And it was about the third emotion that I'd gone through from being diagnosed and being very upset and trying to take it all in, to then withdrawing and not wanting to deal with anybody. And then it was, I don't know where it came from. It was just there. It was there. And I knew I had to do something with it positively. And I should have actually mentioned that I get an awful lot of support from our group, Contaminated Whole Blood UK. Not only do I support them, but they actually support me. We support each other. So, yeah.
Thank you very much.
Thank you, Sir Brian. Thank you. Thank you.
Well, that concludes the business in this room today. Tomorrow.
Sir, there are 3 witnesses tomorrow. The first is Alan Fowle. The second witness is giving evidence anonymously and will be referred to as Mr. B. And the third witness is also giving evidence anonymously and will be referred to as Mrs. C.
Thank you very much. And that starts at 10:30.
10:30 tomorrow, sir.
So 10:30 tomorrow. Thank you very much. Thank you.